I'm Ram Fish, the CEO of 19 Labs, and I thought we will do something a little bit different today. We've seen a few months ago the 100 million investment in CarePods and the amazingly beautiful, stunning healthcare kiosks that they plan on deploying in kind of upscale communities. And we have been very passionate about healthcare kiosks. Since I started the company after leading digital health at Samsung and before that at Apple, uh, healthcare kiosk has been something that we care deeply about. So I thought that we should dive deep into our experience in healthcare kiosks and the lessons we have learned about them. And to do so, I invited somebody who shares this passion with us, our distributor in the Gulf, Osama, who is the CEO of Doctory. And he, I would say, is even more passionate about healthcare kiosks than me. And we both have deep experience on the good things, the bad things, and lots of lessons learned. Osama, welcome to
Hello,
have
Ram.
delighted to have you here.
Thank you very much.
We've
It's my
had
pleasure.
multiple conversation, during Arab Health and visits to customers about healthcare kiosks.
Yes, it's fantastic to speak about the kiosks. We started building softwares and we ended up building kiosks. So it seemed we like to build things, whether it's software or kiosks. You've been in that older than me. You started with the Macs and the other things.
Actually, I would say even more. We started with an individual healthcare kiosk, which is what you have in the background behind you, which is the
Hmm.
original, what we call Florence, the healthcare kiosk at home. Amazingly beautiful. It
Yes.
very much inspired my experience in Apple about building objects of desire. We introduced this in 2015 and it included basically all of the telemedicine platforms that we have today, all the original ideas behind it, devices, first aid supplies, everything neatly, nicely organized. And one of the lessons we learned very quickly when we introduced it was the people who want it don't need it, and the people who need it can't afford it. There is a cost element associated with building physical goods. Sometimes it's in the building, a lot of time it's in the building and operating. And we are going to dive a little bit deeper into the operating costs of the kiosk, which is sometimes forgotten.
Yes, I do agree with you, Ram. It's about the cost, the budget, and the operation. So just like 19 Labs, when we started Doctory, we thought that our beautiful Florence would be at every home. But there's many obstacles about it. Mainly, it's about the cost, how to implement such a great solution at every house, and the budget required for that. So we switched our focus and our resources to building public kiosks, and we found great acceptance for that. So we started, as you know, with our small kiosks in the pharmacies, and then in the community centers for refugees helping in some countries. And lately we start with the big, some of our customers called capsule, others called virtual clinic or smart clinic, but it's like it's the place for the patient to come and just take their immediate or walk-in triage and consultation. So we believe that our market, our region need this. They cannot afford it to have it at home, but they can afford to visit it in the mall, community center, school, pharmacy, or even in some remote clinic or remote hospital which doesn't have the full range of specialties.
Before we dive a bit deeper, I think we need to give credit. And I would say the most innovative company who really created the first healthcare kiosks is American Well. Roy and Ido vision in, I think that was around 2012, so 12 years ago, about the concept of healthcare kiosks, the potential of healthcare kiosks, deserves a lot of credit. Way ahead of the industry, but they have built basically the first, what I would call real healthcare kiosks. And they deserve a lot of credit for innovative and creating those. And American Well is our partner, and we have learned a lot through the partnership, both them and us, about what works and what doesn't work around healthcare kiosks. And that's some of the topics I think we should cover over here. The second part, I think, is, and you hinted to it, Osama, is there is a great potential in healthcare kiosks. The ability to get healthcare in more location is something that I think everybody in the industry is realizing is going to happen. What forms those kiosks take, and what kind of healthcare, and who is the target population, I think these are some of the equations that need to be cracked in order to succeed in healthcare kiosks.
For the last couple of years, we've been meeting customers and discuss with them their requirements about kiosks. Every customer have a different requirements, and I can say they have different dreams. Some of them, as I said, they call it capsule. Some of them wanted spaceship, and some customers focusing on the function, what exactly we'll have inside the capsule. But all of them have one target, that they want to serve the patient everywhere. So they want the capsule to be available in different places, and they would be able to serve that patient who are not able to serve him in the traditional clinic or traditional hospital. By taking their inputs, we managed to build different shapes of kiosks, small kiosk, big kiosk. And even in the big ones, we start having also different versions, something futuristic with less function, but it's more about keeping the patient connected more with the consultation as with the physician, and some of them with more function, as example, a blood test and other features which we adding day by day. Again, there is no fixed formula for the kiosks, and we are trying to understand the requirement of each customer and customize our offering to his requirements. It's the beginning of the road, and I believe by having more players, that will make it more mature, and we can serve in a better way.
I think you're absolutely right, but I think we need to go to a more fundamental way. The most basic first step when you're looking at kiosks, and where a lot of people failed, is figuring out the fit between who's the target population, where are they putting the brands, or where are they putting the kiosks, and what is the brand associated with the location. If you're going for a very high-end population, it's one thing. If you're going for a lower level of population, it tends to have higher healthcare needs, but the right places where they go might be very different. And then there is one point that I've seen a lot of people who try to deploy kiosks ignore, is that there need to be a match between the environment where you put it and the values associated with healthcare. For example, if you want to go for a relatively, Medicare kind of population, somebody might say, oh, let's put it in this cheap grocery store because a dollar market or something, because it's a great place to get, that's where they go. But you don't necessarily want to associate healthcare with cheapo. You are needing to create something that has trust and value and comfort. And the most common mistake we have seen is on this first level. Who's my target market? What are the medical needs? What is the right place to reach them? And what's the brand association with serving them? After this, there is one challenge that's a bit of my pet peeve. But I think one of the biggest problems American well have faced, and not just them, but others as well, is healthcare, especially in the US, entailed significant requirements about privacy and payment. And as a result of it, the first generation of kiosks, the first thing you needed to do when you came into it was log in. But guess what? To log in, you need to remember your password. And because it's healthcare, your password needs to be complicated with lots of those wiggly, crazy things. Do we remember our passwords? No. We let our phone remember our password, or the computer. So the first thing, before they can ever be used, and this is something we changed later on with American Well, people had to log in. And just by the requirement to log in, you immediately killed, I would say, 95% of the people who were interested or needed to use the kiosks. How you solve it, we'll get to later on. But this obstacle is something that I think people realized after they deployed it has been a big barrier to usage.
I can't agree more, because if the patient will have a hassle for logging in or start using the system or even registering himself for the first time, he will hate using it from the first time. There will be no second time for sure. In our kiosks, we address that in different ways. In some scenes, with some customers, we had a standard username and password. But in other places, we've been using the mobile number and OTP to get rid of the username and password. And
That's brilliant. And getting a same user is not something really applicable outside of the US. Even in developing countries or refugee camps, I would not recommend that. But we love the way you used OTP. Put my phone number, I will text you and immediately log in. Was a brilliant solution, and we loved how you implemented it.
we went furthermore. In the UAE, we will have our ID, have a smart chip. So thanks to Gail, we were like authenticating by inserting the ID. So you don't even have to use a mobile number. You just put your ID and get authenticated. Lately, also, we implement the Face ID login. So once you are registered, next time you can log in by your Face ID. So there was different ways to go around the login, and that's remove one of the main challenges you spoke about, and that's give it a lot of comfortable to our repeated customers. So the next time, you either swap their card, the mobile number, OTP. Even in other markets like Saudi Arabia, we are planning to use their national ID number and OTP instead of mobile number. But speaking about the challenges, that's bring me to another challenge or obstacle, if I can call it like that. Not every patient know how to use medical devices. Now, 19 labs in Gale did a great job by building the interface in a way that show every step how to use the blood pressure, how to use the pulse oximeter. And personally, I tried that with people even uneducated, and they were able to figure it. But in general, whenever you tell someone, sit down in a kiosk, in front of a kiosk or inside a kiosk and start using it, he's scared. It's something medical and I have to do it myself. I need a doctor. I need a nurse. I need someone who support me in that, which has brought us to our new pipeline, new map or new plan to start having some kind of avatar in a separate screen that can guide and help people in their own language. So it can remove the scare from first-time users. That's one of
No,
our
I
ideas.
agree on the scale, but there's another solution that we proposed multiple times, and I still feel very strongly about it. And multiple times you've heard me talking that, everybody in industry is talking about AI. I like talking about AGI, human intelligence. The most welcoming experience can be that you touch the screen and within 30 seconds, a nice receptionist, just like as if you walked into a clinic, a human, is telling you, hello, Mr. Osama, nice, welcome you to our healthcare kiosks. Um, how are you feeling today? And then she continues to collect your information, credit cards, insurance number. You can show her the photo. And then she says, okay, let me get a doctor for you. It will take 10 or 15 minutes. I can set up an appointment or we'll do it immediately. But beside adding the human touch is so critical in healthcare. And I'm a huge believer that these small steps that can easily be implemented in healthcare kiosks can make a huge difference in their uptake.
I agree 100%. And this is exactly what we need. This is exactly what have to be added to our kiosks to make it more welcoming, our new patients or even repeat patients.
And we have the technical ability to do so. The important thing for people implementing kiosk is to learn you don't switch for completely from human to technology. There is a mix in the middle of bringing the right element of humans, and this shouldn't be an expensive human resource. This is not a healthcare professional. It's literally the same receptionist that sits in physical offices today, sitting in front of a video camera and addressing 20, 30 different locations as a receptionist over video. Another point I thought will be interesting to talk about is, and we realized it when we started visiting location, is space and the cost associated with space. If you're putting it in a retail location, you have to pay rent. If you're putting it in a pharmacy, in the world of retail, every square feet is expected to generate revenues. Are you generating the same amount of revenues if you put it in a pharmacy, if this is 100 square feet, or is it 10 by 10, or can you fit it into a 4 by 6 to be able to create a smaller environment? How do you balance it with the creating an intimate, trustworthy environment with privacy? Any thoughts on that, Osama?
Yes, actually, many thanks for our partners and customers who's giving us all the beautiful ideas. They're giving us their worries about the space and cost of space. They're giving us about the welcoming feeling and what patient should expect inside. And I do agree with you that when we start building the virtual clinic, the big one which we showed during Arab Health, we are planning to do it 2 by 2 meters. But later on, we found, oh, it will not fit in every space, and it will be bulky, and it'll be costly to transfer it, hard to move it, and as you said, very expensive to host it. So we start shrinking it down to be sure that it can fit everywhere and it's not scary when you see it from outside, still comfortable inside, covering or providing all the functionality you need.
And you created this beautiful standalone kiosk with a screen and the drawer for the devices that you later on used in, I think, Lebanon and a few other customers. Can you talk about this custom design? Because it seemed very small and it didn't guarantee privacy, but to talk a bit about how you used it and what was the use case.
Okay, to be frank, we copy it from Florence. We just feed Florence with some food and we make it
And it
10
started
times bigger.
going. Yeah,
Exactly. So
that always happens to me when I come and visit you in Dubai. I come back 10 pounds heavier.
exactly. So the same. We would put the same ID reader, the same drawers. We just add a printer and bigger screen. So about the privacy, because it was designed to be inside a room in a community center or inside a private room in a pharmacy. It's not for open area. So this is how we guarantee the privacy. Also, and this is very important point, is about the sanitization because people are worried about medical device being used in public for many people. So we were caring about sanitization in that model and in the coming models, and we included UV light sanitization for the devices when they are not in use. Uh, that was a very successful, and it has been used in Saudi Arabia. It was been used in Lebanon. It was been used here in UAE. Speaking about Lebanon, it was a project, humanitarian project for helping the refugees and low-income people who's needed the health care. We've been there for about 18 months in different small cities, villages around Lebanon. We served approximately 1,000 patients every month with all the requirement, vital signs and blood sugar testing. And it was fantastic, especially with the kiosk. We're able to give a great feeling to the visiting patients. Like in one place, we will be using the portable bag, and two other places we'll be using the big kiosk. And the acceptance of the big kiosk was much more, people were taking it seriously more than the bag.
That's interesting. And I think that's part of the power of the 19 Labs platforms, that it's very easy for different partners like Doctory to customize it. We had another partner in Latin America who wanted to customize it for an environment within an employers. And they created basically a 4 feet by 4 feet standalone booth that you can see here. And that is something perfect because it addresses the privacy. It has all the same capabilities, but it fits perfectly into a place where you have small physical constraints. You go in, you can take vital signs, you talk to the doctor, privacy is guaranteed, but it's exactly the same platform. And you mentioned the other form factor, which, let's just put it on a table, stand alone with the devices, and you can see how we have done this. And that I think with one of the big health insurer in the US, that we have used this environment and they put it in the retail stores.
Speaking about privacy, the requests coming now from our customers, they want 100% sound isolation, so nobody can hear what's happening inside. And even the glass have to be frosted when the patient start the consultation. So we start adding these features in our kiosk to serve our customer, especially with our region. Privacy is more in the tradition, not just about the legality of it.
I want to share some other lessons here. When I read the article about the care pods and forward, and you mentioned Max. Max is our attempt to create beautiful healthcare kiosks that can easily be placed in employers in different settings, private rooms, not private rooms. And we had it deployed in multiple locations. What we learned as we did it is there is a significant cost associated with building beautiful devices, especially when you're at low volumes in the hundreds or tens. There is a point in which the beautiful design doesn't necessarily generate more usage. And we learned the hard way that something that might not be as beautiful can cost a tenth of the cost of creating this beautiful object of desire, but still address the same 100% of the functionality. And yes, maybe 5% of the people, possibly even less, depending on your target audience, might not create an emotional attachment to the beauty, but you will actually be able to afford and justify the costs. And that's something we learned the hard way with Max.
Max was a beautiful project. I wish it come back to life one day. Uh, we learned the same actually while building the kiosks. We remember our first kiosk, it was a tabletop, and then we went to the 1.5 meter long, and then we have the big one. Yes, the cost is high. We are trying to utilize available elements that can do the job in the right way, medical grade, medical devices. As example, there was a condition for one of our customers that the air circulating system inside the kiosk have to be HEPA filters. So we have to go and get an engineer to ensure that the air circulating inside is filtered in the right way. The sanitization have to be to avoid the UV light. We were using what they call it fog sanitization. I don't want to go too much details, but the idea, yes, building kiosks will have its own challenges of hardware requirements, software requirements, and software integration, the control, the smart system. But at the end, you get a beautiful solution that can allow the telemedicine to reach more people in more places.
Yeah. I think this is a bit of what I sometimes don't like about Silicon Valley. There is an overemphasis of design, to some extent, I think, influenced by Apple, forgetting about the marginal point in which design doesn't add as much usage and not focusing enough on the value of what you're trying to provide and realizing that especially if you're addressing people with lower income level, you have to very clearly think about the costs. And that's something I think is important for anybody looking at deploying kiosks.
Cost is an important element. And yes, we are working always to ensure that we're able to deliver to our customers kiosk in affordable budget, which they can replicate the success in different places. But if the kiosk is really expensive, like building a clinic, then maybe we'll build one or two kiosks for customers, and that's it. But the idea is to go in rapid implementation, country-wise, uh, based on the success of the initial implementation.
You know, one of the other things other than costs, and we talked about how to make the environment inviting. There
Mhm.
is the design side of it. There is the welcome receptionist opportunity, but there is also the functional. And we have done this. We have a deployment of healthcare kiosks in blue collar, middle of the road casinos throughout the US for employees, not for guests. And one of the things that really drove the usage has been the ability to go into the kiosks and just take your blood pressure, temperature, pulse ox. We didn't ask them to log in. The devices were over there, and they can just go into the kiosk, take their measurements, and know where they are. And that generated a lot of usage. Um, and this usage also created an increase in healthcare awareness among the population that led to more video calls. So just by allowing a first step of, hey, let me check my blood pressure, I don't need anybody to tell me how to do it. I pretty much know how to do it. Make it easy for me. We obviously deleted the information immediately after to protect privacy, but having this kind of an inviting environment was really a way to entice people to use the healthcare kiosks.
That's a great idea. Having like a guest mode, which they can go and start their test without any logging in, or even if it's easy as an ID or mobile number, they don't do it. Just you are a guest, you can just to try the service. If you like it, then you can create an account and do a video consultation. That's a great idea. I like it.
The other questions we got around it was immediately people says, oh, everybody will steal the devices. You need to tie them with, a metallic cable. And I think that comes from a too negative assessment of human nature. We actually, I think, had maybe once a device, blood pressure went missing. And blood pressure are cheap devices. If somebody really steals, one of your employees is stealing a blood pressure, one, you're probably not paying them enough. Second, you probably had the biggest impact on their health by letting them take it away. So that's something I was really not concerned about. Took me a while to convince our customers around that, and it was proven wrong, correct. Trust the people, you'll be surprised in the trust they give you back.
I agree. I agree. And that will open many doors to us and how to improve our kiosks, how to build it in a better way to serve our customers, and to have new innovations, how to add things about welcoming, how to control the cost, how to ensure that the customers or the patients are comfortable while using it.
You talked about innovation. One of the interesting things we looked at, and we've seen a few vendors looking into it as well. Like in CS, I saw somebody who developed a transparent mirror with a display integrated and camera, and they would take your vital signs automatically through the camera. They didn't have any of the telemedicine, so you couldn't do much with it. And it wasn't FDA approved either, because the information can be extracted, but it's still not accurate enough on enough people. But the potential of, in terms of innovative and using a bit of technology as maybe as a gimmick to pull people out or to get you a quick understanding of their healthcare is to use what we developed a few years ago together with a partner is visual vitals. Come over, sit in the kiosks, touch the screen once, and we'll read your vitals within 20 seconds, 30 seconds. The time will come for that. The FDA, I believe, will approve at least the heart rate and the pulse ox measurements probably this year. And once this technology approved by the FDA, I think it will be a great technology to add to deployment in healthcare kiosks.
That's big wow, because it will change the way we look at our health, because you don't need to use a device. You just, as I said, look at the mirror or look at the screen, stay still for 30 seconds. Okay, that's again more welcoming to check your health and to take care about your health. And even it lower the cost of the provider because there is no medical device, there is no consumables, sanitization, cleaning, plus it's faster, which is again the utilization of the kiosk will be higher. So that's a big wow.
Thank you, especially coming from you. The other thing I thought we want to talk about is collaboration and how you collaborate with the different customer needs and different people within the customer, and there might be different people who own the retail or the locations and the clinicians and the technology. So what's the role of the collaboration in here and how do you manage it?
Okay, being from technology background, the technology is the hardest part. Now, about the retail, we don't involve usually. We are a digital health enabler, so it's our partner, our customers who's taking care about the space, whether it's retail or any private space. But we, of course, we have to deal with the technology, we have to deal with the operation, we have to deal with the community members or nurses to train them. The technology one is the hardest one when it's come to integration with other systems and where you're storing your data, how do you extract the data, how we can secure the data. And again, depending on Gale's structure, architecture, and security they build it, we assure our customers that how the transportation of data between the patient and the doctor, and then we give them the option to extract this through Doctory to their EMR system. Now, when it's come to the operation, nurses or doctors, community members, again, the system were built in a way which has allowed people to just use it or learn how to use it in, I will not say 15 minutes, then maximum 30 minutes. And that's removed a lot of hassle from us when we are doing any new implementation in new clinics or remote area. We don't worry about the training. We have the video for the training, but the system itself is open. But it's like an open book. People can learn it very easily. Now, one of the things people keep asking us about is how do you book appointment, how do you charge, how do you link with the insurance, and we explain them always that this is a one module which is doing the virtual consultation, and it have to be connected with other modules from other vendors, whether it's for the insurance or for booking the appointments or for payment or even for more complicated DICOM or whatever advanced consultation required. We are one pillar of the digital health, which can integrate and complete with the others. So the kiosk is there, like a window or a door, remote door to the hospital, to the clinic, and it have to complete with the other components available already in the hospital or the clinic.
Thank you. I think there's a lot of truth in that. My personal pet peeve here is, as you pointed out, to get this deployed requires collaboration. You need to talk to the people in retail, you need to talk to the people with the clinicians. With the clinicians, you'll end up talking to the doctors and the design person and the champion and the legal and the finance, and then you have the technology constraints. In many places, there is an interpretation of the word collaboration as if it means consensus. And what ends up as a result is what I call a design by committee. Somebody wanted it more beautiful, they made it more beautiful. It ended up being more expensive. The lawyer had their own constraints, so we put 5 steps required to log in to promise the privacy. Everything was mixed in, thrown in, and what you get in the end is what, and we have some cartoons here about design by committee. Collaboration absolutely should not mean design by committee. And that's one of the lessons I've also learned at Apple. Somebody needs to lead it, and somebody needs to come up with creative solution. So when the when the lawyer goes and says, I need them to go through all of those term and condition in 5 pages and accept it, and I need the password to have all of those special characters, you can come up with a creative solution like having a receptionist. You should not go toward a consensus. Somebody needs to be leading it, being able to think creatively through the challenges that the different stakeholders have, and then come up with solutions that are ultimately responsible and accountable for. And that's something that I feel very strongly has gone wrong in many deployments.
That's what we in development, I don't know exactly what they call it technically, but the idea, we hear from everyone, but you cannot make a solution which is make everyone happy and still is a functional solution. It will be just like a big truck, which is very hard to move. So we listen to everyone from the community. We listen to the lawyer because he understands his job. We listen to the nurse and we listen to the doctor and we listen even to the patient. But at the end, you need to find the right formula to build your solution. And that's bring me to two examples. As I said, we are a digital health enabler, so we don't operate, but it happened to operate in Lebanon because it was a special kind of project. And when we start listening to the nurses and the obstacle they are facing, as example, in the login, make the keyboard numeric only. Okay, some patient doesn't have mobile number for the OTB. We start hearing that and find, oh, they are right. We can simplify things. We can make it one click without getting our lawyer pissed off. We can do things easier by keeping the others happy. The second example, and here again, I want to give the credit to Gail. We faced an issue with our, with full respect, aged doctors. They are facing problems switching between the EMR system, the medical record, the inside patient information, and the video call. If you made the video call for him smaller, he's not able to see the patient, but he can see the full medical records. So Gail came with this fantastic idea of the augmented reality, having the patient information on the video itself. And that was like fantastic solution to keep the doctor happy without compromising anything else. So we have to keep listening to them, but we don't follow exactly what they need. We use the innovation to build exactly the right solution for everyone.
Thank you. And we even got it patented. And that's probably
Right?
my favorite innovation throughout the 9 years of running 19 labs. So where do you think his market is heading? What's the potential with healthcare kiosks? Is it doomed to always fail? Or what are your thoughts?
I think it is the right for kiosks. HomeKit is still not popular in our region, and I believe the same in the US. And we can see now a lot of rush toward the all-in-one device instead of the HomeKit for home. So let them try their chance in the all-in-one devices. But for the public areas, I believe it's a time for kiosks. We believe in that. We invest time, resources, money. We get our customers happy with what we are doing, and we'll continue to do that because we believe it's the time for it. It's exactly the time here in the Middle East, in the US, in Europe. Everyone, we had the feedback. You saw that by yourself. We had the feedback during Arab Health. Even Arab Health is focused in the Middle East, but we were having people from Europe, we're having people from Asia and Africa come and asking about our kiosks. So it is the time for the kiosk, certainly.
Absolutely, and I can't agree more. I think observing the industry and looking at the different players and what they have done, healthcare kiosks are absolutely going to happen. They're essential. But you need to learn and you need to find the right timing. And the timing is now. There's a lot of lessons we have learned from companies such as American Well, health spot stations that did kiosks also very early on with Steve Cashman leading it. Now CarePods. There is a huge potential and the industry is paying attention, but it needs to be done right. And my hope is that we have been able to provide in this podcast some of the landmines that either we or some of our partners or others in the industry have stepped on and can help different customers or others or competitors be able to build the right healthcare kiosks for the right population, because it's fundamentally about providing healthcare to more people. And that's something that we all deeply believe in. So thank you, Osama.
Thank you, Ram.
You have our contact information for both me and Osama right now. And if you have any questions, thoughts, anything you want to share, please, would love to hear from you.